Hello, and welcome to this presentation by the Foundation for the Education and Research in Neurological Emergencies. This educational lecture is titled Managing Emergency Department Headache Patients, Life-Threatening Headaches and COVID-19 Implications. My name is Edward Sloan. I'm currently Medical Director of the Physician Assistant Studies Program at Dominican University, and I have been an attending physician in emergency medicine at Carle Foundation Hospital. I am Professor Emeritus in the Department of Emergency Medicine at the University of Illinois at Chicago. The content for this lecture comes in large part from the monograph titled Evaluation and Management of Life-Threatening Headaches in the Emergency Department by Dr. Zoda et al. It was published in Emergency Medicine Practice by EB Medicine, February 2019. Please refer to the complete video and audio content for this educational lecture, as well as other individual parts of this lecture via links found at FERNE.org. You may also refer to the initial podcast and the CME option on the EB Medicine website at ebmedicine.net and specifically at the link listed below. Please note the disclaimer listed below. In general, this information is intended to augment and not replace the clinical judgment that guides the management of any individual patient. The next important secondary cause of headache in emergency department patients to be considered is pregnancy-induced hypertension. This is hypertension with associated symptoms and/or lab findings. In general, you have to have a systolic blood pressure greater than 140 or diastolic greater than 90 millimeters mercury times 2 at least 4 hours apart, or any single reading of systolic blood pressure greater than 160 or diastolic greater than 110 times 1. Now, in addition, you must have proteinuria, thrombocytopenia, liver impairment, renal insufficiency, pulmonary edema, or new onset headache. The presence of the latter symptoms and not proteinuria renders the disease more severe. That is to say, you can have mild pregnancy-induced hypertension or eclampsia with proteinuria, but it's considered to be more significant if you have any of the other symptoms, including problems with the blood, liver, kidney, lungs, or neurosystem, including headache. What is our treatment for pregnancy-induced hypertension? Labetalol can be given 10 to 20 milligrams IV and/or hydralazine 5 to 10 milligrams IV by bolus. Nifedipine 10 to 20 milligrams PO can be provided. For severe pregnancy-induced hypertension, magnesium sulfate 4 to 6 grams bolus over 30 minutes, or magnesium 1 to 2 grams per hour till there are muscle or reflex changes, and what will occur, there will be muscle weakness and/or loss of reflexes. When considering the diagnosis and treatment of emergency department headache patients, especially in the setting of this current COVID-19 pandemic, the following can be concluded. Emergency department headache patients who present with potential life threats can be identified. In order to do so, a systematic evaluation is critical, and the electronic medical record can help with this process. Most importantly, subarachnoid hemorrhage can be excluded in patients who present with sudden severe headache, given our current diagnostic capabilities. Also to be noted, head and neck infection, CNS infection, and CNS thrombosis must be considered if subarachnoid hemorrhage is excluded as the likely etiology for patients with potentially life-threatening headaches in the emergency department. During the time of this current COVID-19 pandemic, it is possible that common primary etiologies of headache, such as muscle tension headache, migraine, or even headache related to dehydration, can commonly be seen in emergency department patients. However, when considering patients with potentially life-threatening headache in the emergency department, at this time it is worthwhile to always consider COVID-19 as a potential etiology of these life-threatening headaches. During the time of this COVID-19 pandemic, besides specifically testing for the COVID-19 virus, there's no need to specifically alter our approach to diagnosing and treating patients in the emergency department with life-threatening headaches. If you have any specific questions related to this educational content, please send an email to fern.org@gmail.com. We encourage you also to go to the fern.org website for more content related to this educational program, as well as other content related to the care of patients who present to the emergency department with life-threatening illness and injury related to neurological emergencies. Thank you.